Welcome to Jumade channel. Today we will be talking about hematology, topic anemia. Anemia, a condition characterized by a deficiency in the number or quality of red blood cells, RBCs, or hemoglobin, can be classified based on various criteria including morphology, etiology, and pathophysiology. Here's a detailed classification. 1. Morphological classification. Morphological classification of anemia is based on the size, mean corpuscular volume, MCV, and color, mean corpuscular hemoglobin, MCH, of red blood cells. 1.1 Microcytic hypochromic anemia. 1. Characteristics: small, low MCV, pale, low MCH, RBCs. 2. Causes: iron deficiency anemia, thalassemia, anemia of chronic disease, sometimes, sideroblastic anemia. 1.2 Normocytic normochromic anemia. 1. Characteristics: normal sized, normal MCV, normal colored, normal MCH, RBCs. 2. Causes: acute blood loss, hemolytic anemia, anemia of chronic disease, early stage, bone marrow disorders, e.g., aplastic anemia, leukemia. 1.3 Macrocytic anemia. 1. Characteristics: large, high MCV, RBCs. 2. Causes: vitamin B12 deficiency, folate deficiency, alcoholism, liver disease, hypothyroidism, myelodysplastic syndromes. 2. Etiological classification. Etiological classification is based on the underlying cause of anemia. 2.1 Anemia due to blood loss. 1. Acute blood loss, trauma, surgery, gastrointestinal bleeding. 2. Chronic blood loss, menorrhagia, gastrointestinal ulcers. 2.2 Anemia due to decreased RBC production. 1. Nutritional deficiencies, iron deficiency, vitamin B12 deficiency, folate deficiency. 2. Bone marrow disorders, aplastic anemia, myelodysplastic syndromes, leukemia. 3. Chronic diseases, chronic kidney disease, rheumatoid arthritis, chronic infections. 2.3 Anemia due to increased RBC destruction, hemolytic anemia. 1. Intrinsic, hereditary, causes: sickle cell anemia, thalassemia, hereditary spherocytosis, G6PD deficiency. 2. Extrinsic, acquired, causes: autoimmune hemolytic anemia, microangiopathic hemolytic anemia, e.g., DIC, TTP, infections, e.g., malaria, drugs and toxins. 3. Pathophysiological classification. Pathophysiological classification focuses on the mechanism leading to anemia. 3.1 Hypoproliferative anemia. 1. Definition: reduced production of RBCs. 2. Examples: iron deficiency anemia, anemia of chronic disease, aplastic anemia. 3.2 Maturation disorder anemia. 1. Definition: defective maturation of RBC precursors. 2. Examples: megaloblastic anemia, due to vitamin B12 or folate deficiency. Thalassemia, defective hemoglobin synthesis. 3.3 Hemolytic anemia. 1. Definition: increased destruction of RBCs. 2. Examples: hereditary spherocytosis, autoimmune hemolytic anemia, G6PD deficiency. 3.4 Hemorrhagic anemia. 1. Definition: loss of RBCs due to bleeding. 2. Examples: acute trauma, gastrointestinal bleeding, menorrhagia. Diagnostic approach. To diagnose the type of anemia, the following steps and tests are commonly used. 1. Complete blood count, CBC, to determine RBC count, hemoglobin level, hematocrit, MCV, MCH, and red cell distribution width, RDW. 2. Peripheral blood smear, to assess the morphology of RBCs. 3. Reticulocyte count, to evaluate bone marrow activity. 4. Iron studies, including serum iron, ferritin, transferrin, and total iron binding capacity, TIBC. 5. Vitamin B12 and folate levels, to identify deficiencies. 6. Bone marrow examination, in cases of suspected marrow disorders. 7. Hemolysis tests, including lactate dehydrogenase, LDH, haptoglobin, and bilirubin levels. Conclusion. Understanding the classification of anemias helps in determining the appropriate diagnostic tests